This session will be recorded. So Lynn is also the executive lead of the National Nurse Practitioner Regulatory Framework Implementation Project Plan. This is, in fact, the title, which is the national project that is collaborating for this work. Lynn will be sharing the national perspective of the project and the work to date. My colleagues, Lauren Matthias, strategy consultant, and Natalie Pelado, an education consultant and registered nurse, will be sharing the provincial regulatory impacts and any future opportunities here in Ontario. Together, they will guide us through new regulatory initiatives and help us understand their implication for NPs who are practicing in Ontario. Lastly, we have set aside significant time, a good 30 minutes for a discussion period where you can ask your questions and share your thoughts. We will take your questions and comments at the end of the presentation, and we'll be inviting you to share your questions using the Q&A icon just at the bottom of your screen. Without further ado, let's get started by hearing from Sylvie Crawford.
Good morning, everyone. Thank you so very much, Chantal. Bonjour. So I'm so pleased to be with you today and hope that this will be one of many system partner engagement opportunities as we look forward to really looking at that single classification for nurse practitioners in Ontario. And again, a thank you to my colleagues who are joining us today here and speaking to you. So this initiative is really as a result of coming together across the country. So that's the Canadian Council of Registered Nurse Regulators, and that often we use the acronym CCRNR. And so with other system partners, we're collaborating towards a really common goal of ensuring that NP regulation protects the public and really looks to improving healthcare outcomes for our patient populations across the country. A really important conversation, as especially in Ontario, we've got one of the most populous provinces, and we continue to grow and become more diverse, and our health system needs continue to evolve as well. In fact, today we're looking at about 2.3 million Ontarians who are quoted to being without access to primary care, which means that NPs are increasingly called upon to help support those patient populations and often rely on our NP models for care. So we're hoping that these changes in the healthcare system delivery really have an impact. And we appreciate that here in Ontario, we have about 5,100 NPs. We're really privileged to have all these NPs. And that accounts for actually 55% of Canada's total number of NPs. That does exclude Quebec. So for those reasons, really important that we look at labor mobility, we look at our practice setting flexibilities, and we look at strategies to really look at how do we meet the needs of the population and really advance healthcare professionals, and that includes the role of the NP. So the NP Regulation Framework Implementation Project Plan, that's what's often referred to, really is looking to impact the flexibility with the NPs, employers, governments, and really the need to deliver, really care across services and across patient populations. And so we're hoping by streamlining the entry to practice requirements across Canada, this new regulatory model will really ensure that NPs are educated based on common entry-level competencies and all take the same entry-level practice exam and ready to provide care across patient populations, practice settings, really from the beginning of their career. This will not change the exceptional caliber that NPs provide Ontarians. The skill, knowledge, and judgment and entry-level competencies will be as rigorous as ever. And I know that many of you today are already working across health systems and know you're wondering, so how will this impact going to a single regulation, single classification, and how will that impact your practice? So we're hoping today that we'll be able to share some more information, but we so appreciate that as with big national regulatory changes, this can create some anxiety. And so we hope that your concerns will be answered today, but also appreciate that we'll create the space to continue our conversation as we've got many here today to be able to speak to, but also important to keep in mind this is a multi-year project. And so we may not have all the answers just yet, but we will continue to engage and we'll continue to share as information evolves. So we're looking at the regulation change, we're looking at curriculum changes, and the new national entry level exam. And so while we're working across those same objectives across the country, appreciate that the changes may be somewhat different depending on the jurisdiction and the timelines across Canada. And so because of that, we may not be able to have all the questions quite answered yet. But as Ontario's NP, we already helped to shape this work when the practice analysis survey was released in March 2024. So this past couple of months ago, we have over 700 Ontario MPs fill out the survey, and so grateful that you were able to do so. And that did account for more than 60% of the total number of responses. So thank you for that. But we'll continue to engage you and engage our system partners. And wanted to thank you for joining us today, and really want to continue to look forward to really achieving our national goal, and looking at how we can always evolve our practice and evolve how we support health system needs across the country. So I will turn it over. I'm not sure if Lynn, you're able to say a few words, or we're turning it over right to the presentation. Thank you.
Well, hello, everybody. Whoa. I had my voice stronger. Now I got to work on it. I got laryngitis. Perfect timing. Anyway, thank you for inviting me here. As I was introduced, I am like Sylvie's counterpart in Newfoundland and Labrador. So we're having to do the same work in our province, but we're sharing learnings together. But I was invited because I've been sort of helping the working groups, steering groups, leading some of the practice analysis work, leading some of the exam work. I'm kind of like the connection between all the sub projects. So I think that will be helpful, for me to hear what your questions and concerns are, and hear how Ontario are looking at as we work together as a country. So next slide. So some of this Sylvia brought up, I think it's worth seeing it in writing. It is a new model. It's different in the sense that it's coordinated. As many of you will know, NP practice, NP regulation in the country developed at different points in time in different jurisdictions, and came introduced in different ways. In Newfoundland, they started with a practice protocol type of style. So we have all had different histories, different development. So now we're at this maturity of the NP role. There's an opportunity for us to look and say, how can we enhance it, standardize it, and do a better job of offering right across the country robust opportunities for meeting our population needs. So we're calling it a new model, but it's really that kind of, let's pull together the best of it all. The education is based upon common entry-level competencies. And I'll just take a second to say entry-level competencies are not job descriptions, they're not tasks. They are, broad-based competencies about being able to do a comprehensive health assessment. So the language would be now across populations, across different settings. But they are entry level. It is beginning practice. Sylvia mentioned a one national level exam. I'll show you a slide in a second about where we're at with that, when that should be ready. And again, we're looking for your input, as Sylvia so rightly mentioned. We'll be looking for participants, and we have participants already involved. It's important that we prepare our NPs for versatility of where we need to be, where the population will need to be. So it's across the lifespan, and as beginning practitioners, there's not experts in every area. And remember, every NP is an RN, so we're building upon that nursing knowledge. The one consistent protected title will also help with the population, public, and our other practitioners, our other collaborators in the healthcare system, our other team members, to understand what we're referring to. That's the one that might take a bit of time in different jurisdictions because of legislative structure. Next slide. So this will sort of shows you where we are at nationally. Your team will talk to you about where we are. It actually dates back to 2018 when we did the very first practice analysis of NPs in 2015, got the results, started analyzing and seeing some of the challenges and opportunities from that work. Of course, we all know we hit COVID, and it certainly distracted some particular pieces. So work continued on the development of what might be a part of this project, and developing some principles and some outline stuff. But really, you'll see some of the big work kicking in now in the 2023, 24, 25, 26. So that's what's up there on the slide. So the entry-level competencies have been completed, they've been validated, they've been distributed to the various nursing NP programs across the country. Again, that will be at the jurisdictional approach and relationship and level. They are looking at introducing them. There will be some jurisdictions that will have it actually introduced in the fall of September of 2024. Newfoundland is one. And so depending on the changes that were needed, the type of programs, the process for making changes in programs, each jurisdiction, each program, each nursing faculty had different approaches. What are you involved with Senate, your university, that kind of stuff. So that work is started, it's rolling out, and again, it's jurisdiction specific. Now we're getting ready for the exam. And to get ready for the exam, we repeated the practice analysis because the practice analysis, again, is not a job description. The practice analysis forms the basis for the blueprint for what will we look at. How similar, what are those basic competencies is based on the competencies. Where do we see them? How important are they? How frequently are they there? And that creates the blueprint. Practice analysis is done, and thank you. I'll repeat that. Thank you to UNPs. So now we're doing getting ready for the test plan, and then from the test plan, then there will be item writing, and those regulatory pieces. We do have some item banks. We are working with Measure Learning. We are working with, which is the old ASI. So we do have access to what might have been previously in some of the other stuff. So we're building, working collaboratively, making sure things are giving us a robust, reliable, valid exam. That exam will be ready in 2026 for the programs that are ready to use them. Again, it's readiness is the key. So that's there, that we have to have it ready if the first group come out. It's a 2-year program starting 24. We have to have it ready for the first group. But we will run some parallel exams for a period of time in order to make sure we get the current programs out. And that will vary in each jurisdiction. What's mentioned here is the legacy planning, and the legacy planning is really about what will it look like for the NPs who are currently out there if they want to change streams, if people are re-entering, if people international NPs coming in. That's what we're lumping under legacy planning, and Ontario will present that information, but each jurisdiction is doing that homework and looking at what will be involved in that, and there will be a report coming out on that collectively in the coming months. But again, that one is really jurisdiction specific, same way with legislation. Do you need something changed for your title, a common title as an example? Next slide. So it's important to appreciate there's been lots of opportunity to get involved. Has it been perfect? Has everybody been aware? Has everybody been engaged? No, never perfect. We're delighted we have the opportunity to continue talking through these jurisdictional forums. We encourage people to reach out. In the next slide, I'll tell you a website where you can actually get our communications, because it's there from day one to current, what's happening in the project. But there has certainly been a fair bit of consultation. I'll just take a moment and highlight that there is an advisory panel. And that advisory panel is certainly made up of people across the country. There's also a stakeholder panel, which is got more of a mixture of employers and partners, and there's some international lens there. There's discussions ongoing related to specialization. We never did regulate specialization like mental health or cardiac or renal, but there was old models, protocols, etc. So we're excited that there's conversations happening outside of us, but we're participating on what might be done to standardize specialization, because there's definitely value in continuing education, post-regulatory, voluntary, continuing education. There's some research work that's being done by the Canadian Association for Nurse Practitioners and Research, I think is the title. Lauren will fix it for me if I have it wrong. And they are leading some of this work. They are working with like CASN and CNA and other groups and internationally to look at what we can all complement to see, because there's some value in that, but again, it's outside the regulatory scheme. And we certainly are talking with governments because workforce availability, meeting population needs into the future is certainly an ask of government, of us as regulators to work towards an enabling system. So the next slide just shows where you can get more information. Oh, sorry, I jumped ahead too much. I will take a pause to tell you that there has been separate discussions around the neonatal nurse practitioners. No, you can keep it under neonatal, thank you. In the sense that the analysis of the educational program and entry-level competencies and what's taught in courses in the neonatal and the clinical exposure it's radically different than what might have been in the adult, family all ages, or even some of the pediatric. Simple example, neonatal is described as the first, so many days of life up to a month, is the official definition, but there are variant versions. So you're not getting into chronic disease management or the long-term impacts the same way. So there's been a decision made in Alberta. They're going to keep running the neonatal program. And Nova Scotia are looking at that as well. But how that will roll out in interjurisdictions is like the legacy plan. We're looking at that and looking at it, and there's some conversations happening. So I'll leave that again to your own team. But that's, again, being responsive to population needs, government demands, analyzing the evidence, looking at the distinctions in the various programs. This was a decision made by Alberta and is under discussion in Nova Scotia. And they are the two sites that had a program still running. And again, I'll let Ontario talk about it. Now, the last slide is about how to connect and learn about our resources. So if you go to that site, you will get our core documents, and you can subscribe to our newsletter, so you'll get it right in your inbox and something new is there. So you will, again, like the executive summary or the practice analysis will likely come there. So I encourage people to look at that, share it with people that are interested in it, and provide us feedback too. So I'll pass it back over to your own team now. Thank you very much.
Thank you very much, Lynn, for an informative overview of the work occurring nationally. And thank you for joining us. And on behalf of the team, we're wishing you a speedy recovery. Keeping the discussion going, I'll turn it over to the final speakers, Lauren and Natalie, who will speak to us on how this project is impacting regulation here in Ontario.
Thanks, Chantal, and good morning, everyone. My colleague Lauren and I will now be highlighting the impact of the national framework for Ontario NPs and system partners. Next slide, please. So Ontario was one of the first Canadian jurisdictions to legally recognize the NP role in 1998. And as Sylvie mentioned, there are approximately 9,200 NPs registered to work in Canada, and of those, 55% of them are registered with CNO. In Ontario, within our current regulation framework, NPs are educated in one of three population streams and registered in either the adult, pediatric, or primary health care specialties. There are over 5,100 NPs registered in Ontario, of which 79% are registered with primary health care, 15% in adult, and 6% in the pediatric specialty. Less than 1% of NPs are registered in multiple specialties. Even with the distinct requirements for obtaining and maintaining registration for each of the specialty certificates, all NPs practicing in Ontario are subject to the same legal and legislative scope of practice, the same national entry-level competencies, and are governed by the same NP practice standard. Next slide, please. CNO is committed to the public's right to safe nursing care. The proposed national framework is creating a single NP classification in response to the evolving capacity of NP practice and the needs of the healthcare system. To respond to system needs, we need regulation changes that support progressive change and modernization. This framework is to enable the appropriate level of regulation in the public's interest and foster a more mobile and responsive NP workforce, one that recognizes NP's desire for growth and equips NPs to work in a rapidly changing healthcare environment. In Ontario, this would mean retirement of the adult, pediatric, and primary healthcare specialty certificates, evolving toward a single NP classification that encompasses all NP practice across patient populations and practice setting. This change can increase flexibility for different groups. NPs may have more flexibility to make career changes and serve broader patient populations. Employers may have more flexibility for deploying nurses, and governments may have more flexibility for health human resource planning. Next slide, please. To align with the national work, CNO has taken steps to support national collaboration in the following ways. The national NP entry-level competencies were updated in 2022 as part of a regular 5-year review cycle. Entry-level competencies, or ELCs, are a regulatory tool. As Lynn mentioned, they provide a broad understanding of foundational knowledge, skill, and judgment expected of professionals when entering practice. Regulators use ELCs as part of the education program approval process and expect programs to use these ELCs as a broad template to develop and update their curriculum. CNO's council endorsed the revised NP entry-level competencies in December of 2022, and we are working closely with our academic partners to facilitate their implementation through our program approval process. Universities are ramping down their NP specialty programs. Like Newfoundland, starting this September, all Ontario universities will provide programs that address NP practice across the patient lifespan and practice settings. The NP programs will be incorporating simulation labs and clinical placements as available across the lifespan and practice settings, including adult, peds, long-term care, primary health care, acute care, etc. CNO is working closely with national jurisdictions to develop a national entry-level NP exam that is aligned with the ELCs. In 2024, the National NP Practice Analysis Review was completed, and as Sylvie mentioned, a special thank you to the over 700 Ontario NPs who participated in that practice analysis validation survey. We so appreciate the strong engagement from our Ontario NPs. Your feedback will help to inform the development of the new NP entry-level exam. And results from the 2024 practice analysis will be available later this fall. Thank you. I'll now hand things over to my colleague, Lauren.
Great, thanks, Natalie. So this national project's purpose is to increase access to healthcare services and reduce practice barriers. CNO recognizes that NPs currently registered in specialty certificates have obtained a solid education foundation and contribute to safe patient care. We are working closely with the national group and nursing jurisdictions to determine what supports current NPs registered in specialty certificates will need for a seamless transition into the new model. In Ontario, with the proposed retirement of specialty certificates, we envision that all current NPs, as part of legacy, will be transitioned into the new framework without impacts to those in current practice. These NPs will continue to work within their current education, knowledge, skill, judgment, and maintain their competencies by participating in CNO's quality assurance program. More details on legacy planning will be shared in the fall of 2024. Transition planning discussions are underway for current NPs with consideration to title use. We will provide information and guidance on NPs' title use and credentialing before we implement this model in Ontario. Next slide, please. To support a move towards one classification and retirement of specialty certificates, regulation changes are needed to align with process, transition, and title. CNO will look to propose changes to NP regulation under the Nursing Act to support implementation. This might also mean proposed changes to CNO bylaw and outlining clear processes and policies to support transition. Proposed changes to regulation might see current specialty certificates, education programs, and the specialty exams to shift towards a single classification of registration, education programs that train across patient population, and a single entry-level exam. What might not change within the current framework are eligibility for registration as a registered nurse in the extended class, in the general class, my apologies. NPs have always had a common entry-level competency and common NP practice standards. NP accountabilities will not change, NP scope of practice will not change, NP QA requirements will not change, and NP evidence of practice will not change. NPs must maintain clinical NP practice consistent with the extended class. Next slide, please. So as mentioned, this is a multi-year project, and CNO plans to broaden our communication and engagement reach with the public, NPs, applicants, and system partners on the proposed changes and impacts in Ontario. CNO continues to work with academic institutions to facilitate the transition of implementing a program that prepare NP graduates to provide health services to patients across their lifespan. CNO is engaging with employers as part of CNO's employment reference group to communicate the change and impact to NP registration and our continued focus on safe nursing care. We hope also to broaden our reach with employers. NPs can continue to specialize through continuing competence, employment mentoring, training opportunities, and education programs. CNO is also engaging Ministry of Health staff on the proposed NP regulation framework, and there is general support. You might be aware that the Ontario government recently announced plans to consult on expanding the scope of practice for NPs. As mentioned earlier, irrespective of the specialty certificate, all NPs are accountable to the same practice standards and legislated scope of practice. In the future, subject to the scope of practice changes government proposed taking effect, these will continue to apply to all NPs. Next slide, please. CNO continues to engage its council, our board of directors. In June of 2024, our council approved CNO's continued work towards a national regulatory framework and classification of NP registration in Ontario. CNO plans to bring proposed regulation changes to council in the fall. Our council meetings are live streamed on YouTube and other platforms and are open to the public, so stay tuned for more information on this. While discussions on legacy planning is in progress, CNO will continue to engage in discussions with system partners and NPs to support transition to the new NP regulation framework and to promote role clarity. Next slide, please. So we want to hear from you, NPs and system partners, and to connect on key changes. In June of this year, we launched information on the national framework on cno.org. We will continue to update this webpage with the latest information when it becomes available. As Lynn mentioned, NP and system partners can also look to the national project website for more information. Please continue to engage and share your experience and questions with us on this work via social media or contact us directly. I will now hand it over to Chantal to moderate the discussion session. Thank you.
Thank you, Lynn and Natalie, and really all the speakers today for sharing valuable insights on the project impacting NP regulation both nationally and here at home in Ontario. The information shared today has clarified the regulatory changes ahead and their implication for the profession of nurse practitioners. I also recognize that this work is ongoing, and I appreciate your continued efforts and contribution to this evolving discussion. We now have reached our Q&A portion of the event. The Q&A feature on Zoom is open, and we want to hear from you. I'll turn it over to Ben.
Thanks, Chantel. So thanks to everyone who has submitted the questions prior to the session. We can read out some of those, maybe some of the more popular ones, and then throw it to the live questions. Sylvie, this one might be a good one for you to answer or to start with, perhaps, around employers. Will employers need to take on more orientation and training to support entry-level NPs to practice in specialized practice areas? And they gave examples like neonatal, geriatric, and mental health.
Sorry, I had to get my unmute. The current, so I'll start with really starting September, so this past September, all the universities in Ontario will provide the programs that address the practice of the lifespan and in all the practice settings. So the NP programs themselves will be incorporating simulation, they'll continue with labs, clinical placements are available across that lifespan and those practice settings. So for example, it will continue to be adult, will continue to be peds, long-term care, public health, acute, all of those. And so from the current NP entry-level programs, don't graduate as specialists. So graduate equipped with really all those entry-level skills and knowledge to provide the patient-specific, population-specific care. So the NP programs actually provide that foundation in preparing the NPs to provide that comprehensive healthcare services across all age populations. Hope that answers the question.
I can make a comment if I get it out. One of the best things with this project, it has helped us realize that maybe people didn't understand the role as well. Now I'm talking national. Maybe people thought they came out as expert NPs in a specialty area because they were expert nurses maybe in that area, or because there was a robust orientation, or because of a team approach. So it's allowing us, and this is where the specialization evidence work that committees are working on, has allowed us to realize that it probably wasn't standardized across the country. And there probably was really good success stories with some employers in some settings. And is there an opportunity now to elevate that and look at that? And this is like what Kazan is mentioning. They develop standards, guidelines. Is there something that we could talk about that makes it, again, more consistent across the country, that talks about, this is entry-level competencies, as Sylvie said, is the standards, it's the beginning. But is there now more we can collectively look at with our research experts or academia, our employers or whatever? So it's not a shifting of a download. I think it's really been an opportunity to expose maybe something that maybe was not consistent and not fully understood. So again, we will need the input, and more discussion would occur, because we are hearing some fantastic success stories, and then we're also hearing some, oh, I don't understand that. So I think it's an opportunity, and this is where some of the research work is entering.
Thanks for that, Lynn. And I recall during the presentation, we also talked about the parallel to the entry-level competencies for the registered nurse. Appreciating when you go into a registered nurse program, you get exposure to all the different life cycles. You can work in surgery, OB, labor and all those different places, long-term care. So it's again following entry-level competencies, as Lynn mentioned, the beginning of the journey into NP scope of practice. Thank you, Ben, for that question.
Great, thanks to you both. There's a question about current practicing NPs who only have a single designation due to the nature of their university program. Will these NPs be able to cross over into a new area of practice? For example, primary healthcare NP gaining employment in a hospital specialty like cardiology or gerontology? Natalie, maybe do you want to answer this?
Sure. Thanks, Ben. Thanks for that question. So as part of legacy planning, current NPs who are registered in the primary healthcare adult or PEDS specialty certificates will transition into the one registration classification of nurse practitioner. As is the case with currently registered NPs, they are required to reflect on their practice and identify gaps in their knowledge, skill, and judgment so that they have the education and training to provide that safe, competent care for the setting and the patient population at hand. And just to add, in the current model, CNO does not stipulate the setting, but rather the population for which NPs can provide services. Hope that answers the question. Over back to you, Ben.
Great. Thanks, Natalie. Another one, for when the change happens, would employers such as hospitals, hospital networks, health teams need to be formally notified? Would job requirements need to be modified to reflect that any NP can gain employment in a specific role? Lauren, maybe?
Thanks, Ben. So this, as we mentioned in the presentations, this is really a multi-year project. And CNO plans to have broad as well as targeted conversations and engagements with system partners, especially employers, on the proposed changes and the impacts for both NPs and employers in Ontario. So we have had conversations as part of the employer reference group to understand the impacts of these changes to NP registration and the ability of NPs to continue to address patient needs. And we will continue to expand our reach and have these important conversations. Thank you.
Thanks, Lauren. Maybe one more question before we throw it to the live questions, Chantel. And this one may be for Natalie, as it's education based. For current practicing NPs who have a specialty, will there be, due to the nature of their program, such as a primary healthcare NP, will there be university level programs like one currently offered at U of T? And they mention the care of the hospitalized adult program to gain employment or switch from one specialty to another.
Thanks, Ben. Great question. So the University of Toronto Care of the Hospitalized Adult is a great example of a continuing education course for NPs to develop and maintain their competence. And we are engaging with our academic partners around future continuing education courses for NPs. Keeping in mind the response to an earlier questions, nurses are autonomous professionals. They do reflect on and identify their competency gaps for providing safe care. So in some instances, that continuing competence may be taking a course, while in other instances, on-the-job training with a mentor may be more relevant. CNO doesn't approve or endorse any specific continuing education or programs or certifications, nor do we determine what is required to work in a specific practice setting. And so again, it's really identifying your own learning gaps and maintaining that continuing competence. Thanks, Ben.
Thank you, Natalie. How are we going? So here's a live question here for the panel. How are we going to standardize the language of how NPs are described nationally? Are you working on eliminating the language of RNEC and moving towards only referring to NPs as nurse practitioners? This lack of common language is confusing to the public and has significant patient safety concerns for understanding the role and scope of the provider.
Well, I can start with the national goal is yes, that's what's on the table, that we call ourselves nurse practitioners right across, because that part of the title is consistent right across. And we're starting to really create public awareness of what it is. We're starting to create a research field about the value, the outcomes. We're starting to, like I said, get it integrated in employment roles, etc. So nationally, that is the goal. However, the jurisdictional language is back to the Ontario crowd about how you will approach it. But that is one of the targeted goals of the national initiative, to go to a common language.
Thank you, Lynn.
I can
Another-
respond to that.
Oh, please. Yeah.
So within Ontario, we are still having discussions as to how this model will be implemented, and we are proposing regulation changes that will be coming to council in the fall. So more to come on that. Really, I agree, and we agree. CNO agrees with the national approach, which is really putting forward the nurse practitioner role. But there are more discussions to be had, so more to come on this.
Yeah, and maybe if I can add, Chantel, the discussions are based on, there's a process in order to make these changes, both conversations with council, the oversight authority of CNO, and then our ministry partners around language within legislation. So, and as Lynn mentioned, we're all at different stages of implementing this framework. So, so yes, Ontario is very much aligned to many of the principles that we've all endorsed across the country. It's just the implementation may look, and timelines may be slightly different amongst the jurisdictions. But we too have heard the importance of the consistency in the title across the country, and that being the NP. So thank you for that question.
Thank you all. Another question here. Wondering if CNO will provide bridging education for NPs with only an adult or pediatric designation.
I can start us off on that one. As mentioned in some of the other questions, we are working with our academic partners to look at developing further continuing education or bridging courses, so that those NPs who are registered in one specialty and do want to broaden their practice will have the ability to do that. Recognizing also, I think, as I said in one of my earlier responses, that based on the assessment of your competency gaps, might not always be a course that's required, but perhaps on the job training, mentoring. So definitely something that we recognize there's a need, and that we are working on.
Thank you, Natalie. A follow-up on education here is a person who may take an NP program through the US or another province that offers specialty training. Does this mean that they will not be eligible for registration as an NP in Ontario?
I can respond to that one. So we are doing more work in terms of looking at how jurisdictions process and adjust and sort of go into the detail with regards to how this framework is going to evolve and be implemented. And so we are looking closely at what happens in the US, and we currently know that US, similar to ourselves right now, do register based on specialties. So we will be looking more in terms of what these registration processes will mean and how we can support NPs coming from other jurisdictions as well as coming from other countries like the US to support that labor mobility.
Yeah, maybe I'll share. There are many, not just Ontario. I know that my colleagues, Lynn, but all of us are looking at, how we evaluate programs for internationally educated nurses or NPs. So that work is not part of this, but I know that it's going on in many jurisdictions, including the work we're doing in Ontario. And so that will be parallel, but that's not specifically aligned like directly linked to the work we're currently doing around the entry-level competencies within a national NP framework here in Canada. But appreciate the question, and I know that there's many questions around, how programs are assessed for those that are internationally educated. And I do know that we're all looking at that, including us here in Ontario. Very good question. Thank you for raising that.
And I'll add, one of the important things about this being national is that we're all committed, and we have the Canada Free Trade Agreement legislation that talks to us about how we need to be fair and analyze things. So we're respectful of the working together, coming up with something common. And so that principle will be there. It goes back to what Sylvie said about timelines. Sometimes it might be the timing of something, but ultimately, this is the goal, that we're more consistent right across. In everything, entry level, whatever, your unique competencies will be your unique competencies, but then that mobility will be enabled in a much more expedited way once we get on the outside of this project. So that's one of the long-term goals for sure.
Thank you, everyone. We'll take one final question. The question, I think we've touched on it a little. I'm a pediatric NP, so it would be up to my judgment if I have the skills to work with certain adult population after this transition to the new NP regulation.
Yeah, so I can start. The short answer is yes, and not so much your judgment, but again, that self-reflection and really assessment of your competency, your knowledge, skill, and judgment to work with the population at hand.
And it's probably not fair for me to interject in a local thing, but I am a registered nurse. I have been working in the regulatory scheme here in this office for eons, 20 years or something. I have a license to practice. If I decide to go back out in ICU, I got a lot of learning. If the employer wants to take me on, they're going to work with me. They're going to do an assessment. We're going to work. What we're proposing is a similar approach in principle. Again, it has to be worked out, is that RN accountabilities, NP accountabilities, working collaboratively in teams, knowing your limits and where you want to go and what you've done, and building on that concept of the professionals that we all are. But it has to be done in collaboration. But I just use my example that I certainly would need to do a lot of reflection and bridging, but it wouldn't be imposed upon me on the regulator. It would be a part of what I would do as part of my QA, continuing competency, employment setting, and my concern about protecting the public and doing what's right and being skilled and knowledgeable and competent. So I think some of these things we need to think about it, even though there's an advanced practice, there is a higher level of knowledge and skill there. It still is the foundation, is the same as I think many of the people started. It's the same accountability standards across the way. So I'll just add that reflection because people have told me they found that helpful.
And maybe if I could add, for those who may be considering, I'll say, a practice setting change, please reach out. Certainly Ontario, reach out to us at the college, but if you're, whatever jurisdiction you're in, reach out to that regulatory body. There's many resources that are available. Having conversations with advanced practice, consultants, all of those may help inform your self-reflection and really your ability to understand, how to navigate if you're thinking about a practice setting change. We have looked at the entry-level competencies that were previously for all the various programs, both adult, primary care, and pediatric. And there was, strong linkages between those. But that doesn't, as Lynn said, take away from the expertise that's built when you're within a practice setting for a lengthy period of time. That is beyond kind of foundational education So please reach out. Certainly Ontario, reach out to us if you have questions around, changing a practice setting and how we could help support your self-reflection, your assessment of your skills and competency and judgment to support you in that way. And then, of course, as Lynn said, the employer, right? There's always your employer who will be willing to jump in, because at the end of the day, we all are focused on the same thing, and that is safe practice for yourselves as registrants, but in that protecting the public. So hope that was helpful. Thank you.
It was helpful. Thank you, Sylvie. And thank you all today for joining the town hall and for sharing your thoughtful questions. While we were not able to address every question during this session, please note that each of these questions are important to us, and we will be reviewing these questions and working to provide comprehensive answers to these questions. And to stay up to date, please do keep an eye out on our website, thecno.org, where we will be posting additional information as we move forward with this initiative. Thank you all again for your participation and your valuable input.